My dog licked her paws raw for 3 springs before I realized it wasn't anxiety. Turns out 30% of dogs suffer from seasonal allergies, and most owners miss it because pets don't sneeze like we do. They itch relentlessly. Paws, belly, ears. If your dog's scratching more when the flowers bloom, it's not in their head. Talk to your vet before that itch becomes an infection for appropriate treatment and management options. Allergy control focuses on reducing exposure and relieving symptoms. Frequent bathing with medicated or hypoallergenic shampoos. Wiping paws and coat after outdoor walks to remove pollen. Flea control year-round. Antihistamines, omega-3 fatty acids, or prescription medications as directed by your vet. Allergen-specific. Seasonal allergies are common but manageable.
Your dog's constant scratching isn't just annoying, it's their immune system attacking itself. Allergic skin diseases are among the most common chronic conditions seen in small animal practice today. Across North America and globally, veterinarians are witnessing a steady rise in dogs and cats presenting with persistent itching, recurrent ear infections, and chronic skin irritation. These cases often fall under 2 major categories of allergic disorders: atopic dermatitis, environmental allergies, and adverse food reactions, food allergies. Both are immune-mediated conditions that share overlapping clinical signs, making diagnosis challenging even for experienced clinicians. Itch is a complex interplay of genetics, immune function, environment, and nutrition.
Atopic dermatitis, AD, refers to a genetically predisposed inflammatory and pruritic skin disease associated with the production of IgE antibodies against environmental allergens such as pollens, molds, dust mites, and other airborne substances. It is non-contagious, chronic, and often seasonal at first, though it may become year-round over time. Food allergy, more precisely termed adverse food reaction, AFR, involves an abnormal immune response to a dietary component, usually a protein source, leading to similar dermatologic and sometimes gastrointestinal signs. Unlike environmental allergies, AFRs are non-seasonal and persist regardless of environmental changes. Same symptoms, totally different triggers. Most dogs have both, which is why that single solution keeps failing.
Epidemiologic studies estimate that 10 to 15% of dogs and up to 6% of cats may suffer from allergic skin disease. Certain breeds, such as Golden Retrievers, Labrador Retrievers, Bulldogs, West Highland White Terriers, and Siamese cats, appear more predisposed, suggesting a strong genetic component. The economic and emotional burden is significant. Chronic itching leads to secondary infections, repeated veterinary visits, and lifelong management. Many pets experience reduced quality of life, constant discomfort, sleep disruption, and social withdrawal. From a clinical standpoint, allergic disease represents one of the most complex dermatologic challenges, requiring systematic elimination diagnostics, pet parents' education, and long-term commitment rather than a one-time cure.
Your dog's allergies aren't random. They're a consequence of modern life. Why allergies are on the rise? Urban living and indoor confinement. Pets spend more time indoors with limited microbial exposure, mirroring the hygiene hypothesis seen in humans. Year-round exposure to allergens. Climate change and indoor heating systems extend pollen seasons and dust mite survival. Dietary changes. Commercial diets introduce a variety of protein sources, increasing the likelihood of sensitization. Genetic selection. Popular breeds with known predispositions are increasingly overrepresented. Environmental pollution and irritants. These may alter immune responses or damage skin barriers. The combined effect of these factors leads to heightened immune sensitivity and reduced tolerance.
Your dog's itching isn't random. Atopy versus food allergy, the diagnostic challenge. Clinically, both atopic dermatitis and food allergy present with pruritus, itching, erythema, redness, and chronic otitis externa, ear inflammation. Distinguishing between them requires methodical investigation rather than assumptions. A common diagnostic pitfall is treating every itchy pet with empirical medications without pursuing the underlying cause. While corticosteroids may provide relief, the root trigger, whether environmental or dietary, remains unaddressed. A systematic approach includes: rule out ectoparasites, fleas, mites. Control secondary infections, bacterial, yeast. Assess seasonality and pattern. Perform dietary elimination and challenge tests. Consider allergy testing for diagnosis.
Allergic reactions in pets are not isolated events, but manifestations of immune dysregulation. The skin, as the body's largest organ, serves as a barrier against allergens, pathogens, and irritants. When this barrier is compromised, whether due to genetics, nutrition, or environmental factors, allergens can penetrate more easily, activating immune cells and triggering inflammation. The interplay between genetic predisposition, environmental allergen exposure, and skin barrier dysfunction forms the cornerstone of modern understanding of allergic diseases in pets. In recent years, research has also highlighted the role of the skin microbiome, the community of microorganisms that live on the skin surface, in maintaining immune balance.
The importance of education and collaboration. Successful allergy management depends on collaboration between veterinarians and pet parents. Because these are lifelong conditions, compliance, communication, and patience are crucial. Educating owners on realistic expectations, that allergies can be managed, not cured, is key to maintaining trust and adherence. From the veterinarian's perspective, understanding the latest immunologic concepts and treatment innovations allows for tailored, multimodal therapy. From the pet parent's perspective, consistent home care, diet control, and follow-up appointments are the foundation for keeping flare-ups under control.
The immune system is protector and sometimes overreactor. The immune system is designed to protect the body from harmful invaders, bacteria, viruses, parasites, and toxins. In allergic pets, however, the immune system misidentifies harmless substances like pollen or chicken protein as threats. This leads to an exaggerated inflammatory response. This inappropriate immune response is the foundation of allergic disease. To understand how this happens, we need to look at three major components: genetic predisposition, skin barrier dysfunction, immune dysregulation, and hypersensitivity reactions. When these factors align, a pet becomes allergy-prone. When all three collide, your dog becomes allergic to life itself.
Genetic susceptibility. Born with sensitivity. Research shows that allergies in pets, especially dogs, have a strong hereditary component. Breeds with increased risk include retrievers, Labrador, Golden, Bulldogs and French Bulldogs, West Highland White Terriers, Boxers, German Shepherds, Shih Tzus, Pit Bull-type breeds, Siamese and other Oriental-type cats. These animals are more likely to develop allergic dermatitis due to inherited differences in skin barrier function, immune cell signaling pathways, cytokine responses, IgE production tendencies. But genetics alone doesn't cause disease. The immune system must also be triggered by environmental or dietary allergens. But here's the twist. Genetics loads the gun. Environment pulls the trigger.
Healthy skin has a lipid shield that locks allergens out. Afflicting skin barrier dysfunction, the first crack in the armor. The skin is the body's primary barrier against allergens. In healthy animals, the skin surface contains lipids, ceramides, structural proteins, filaggrin, and a balanced microbiome that together keep allergens out and moisture in. In allergic pets, the skin barrier is compromised due to reduced ceramide levels, increased transepidermal water loss, micro-injuries from excessive grooming, scratching, genetic defects in barrier proteins. Chronic inflammation deteriorates the protective layers, this weakened barrier. Allergens penetrate deeper layers of the skin where immune cells reside, leading to activation of inflammatory pathways and itching.
Your pet's first exposure to an allergen is silent. No itching, no redness, nothing. But inside, their immune system is building a trap. As a pet is exposed to an allergen penetrates the skin barrier, encountered by Langerhans cells, skin dendritic cells. Langerhans cells grab the allergen, show it to helper T cells, which flood the area with cytokines. B cells start mass-producing IgE antibodies that latch onto mast cells like loaded weapons. Your pet seems fine, but they're now primed. When the pet encounters the same allergen again, the allergen binds to the IgE-coated mast cells. This activates mast cells, causing them to release histamine, proteases, pro-inflammatory cytokines, leukotrienes. These chemicals trigger itching, redness, swelling, skin inflammation.
Your dog's constant paw licking isn't just anxiety, it's their gut screaming through their skin. Food allergies don't start in the mouth. They start when the gut loses its ability to recognize safe proteins, triggering the same itch-scratch cycle as seasonal allergies, but year-round. Mechanisms involved include increased gut permeability, leaky gut, abnormal antigen presentation, T helper cells skewing similar to atopy, mast cell activation in the GI and skin. Blood tests often miss it because half of food reactions bypass IgE entirely. If ear infections keep coming back despite treatment, you're treating the symptom while the real culprit hides in their bowl. Even though the immune pathways differ, the clinical signs often mirror atopy: vomiting, diarrhea, soft stool, and flatulence. Your dog's first exposure to the allergen, 0 symptoms. No itch, no redness, nothing. Their immune system was silently building the reaction that would eventually make them miserable. That first contact with allergens, it was training their body to attack it next time. By the time you see the scratching and hot spots, sensitization already happened. The trigger you're trying to identify now, your pet's been exposed to it before without a single sign. The reaction comes later on re-exposure. Understanding the silent first phase helps explain why allergies often appear suddenly in pets that have been normal for years. Dogs and cats may develop allergies to foods and environment at any age, but usually require repeated exposure. A pet can seem fine one season and symptomatic the next.